As we get older, many of us begin to notice subtle discomforts in our bodies aches we hadn't felt before. Sensations we might dismiss as minor indigestion or just something I ate. Among these is a condition that often goes unnoticed until it becomes dangerous. Stomach or duodenal ulcers. A stomach ulcer, also known as a peptic ulcer, is more than just a bellyache. It's a real wound, a sore that forms on the lining of your stomach, small intestine, or sometimes even the esophagus. These wounds aren't visible to the naked eye, but they can cause significant pain, bleeding, or worse if left untreated. Ulcers are more common than you might think, especially in older adults. One of the biggest challenges is that they often masquerade as other conditions: heartburn, indigestion, gas. People may ignore the symptoms, not realizing that these minor signs are warnings from the body. When caught early, ulcers are treatable. But when ignored, they can lead to serious complications, including internal bleeding, infections, or even a perforated stomach, which is a medical emergency. So why do ulcers happen? In simple terms, the stomach produces acid to help digest food. But the stomach also protects itself with a special layer of mucus. If the balance between this acid and protective mucus is disrupted, acid begins to eat away at the stomach lining. Over time, a sore forms, what we call an ulcer. The two leading causes of this imbalance are an infection by a bacteria called Helicobacter pylori, and the use of nonsteroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen or aspirin. These are medications commonly used to relieve pain, especially in older adults with arthritis or chronic conditions. But overuse, particularly on an empty stomach, can damage the stomach lining and lead to ulcers. Helicobacter pylori, or H. pylori, for short, is a clever little bacterium. It can live in your stomach for years without causing any symptoms. You might feel completely fine and still have this bacteria slowly damaging your stomach lining. It's only when enough harm is done that symptoms like pain, nausea, or bloating begin to appear. Aside from bacteria and medication, lifestyle habits also play a role. Smoking, drinking alcohol, skipping meals, eating spicy or acidic foods, or living with chronic stress can all weaken the stomach's defenses, while none of these cause ulcers on their own. They contribute to the problem and make healing harder. Now let's talk about symptoms. Ulcers don't always shout. Sometimes they whisper. The most common sign is a burning or gnawing pain in the upper abdomen, often between meals or at night. Some people feel bloated or nauseous. Some experience unexplained weight loss, and others might have black or bloody stools, an alarming sign of internal bleeding. The only reliable way to know if you have an ulcer is to be examined by a doctor. Today, the gold standard is a procedure called an endoscopy. A tiny camera is inserted through the mouth to take a close look at the stomach lining. This test helps doctors see the exact location and severity of any ulcers. Sometimes a small sample, called a biopsy, is taken to test for H. pylori, or rule out cancer. There are also non-invasive tests to detect H. pylori, like breath tests, stool tests, and blood tests. These are helpful tools, especially when symptoms are mild or when an endoscopy isn't necessary. Once diagnosed, treatment is usually very effective. The main goal is to reduce stomach acid, kill the H. pylori bacteria if present, and protect the lining to allow healing. Doctors often prescribe a class of medication called proton pump inhibitors, or PPIs. These drugs work by lowering the amount of acid your stomach produces. If H. pylori is found, a combination of antibiotics is used to remove the infection. If NSAIDs are part of the problem, your doctor may recommend stopping them or switching to a safer alternative. In some cases, they'll prescribe additional medications to shield your stomach while continuing treatment. Now you might be wondering, what happens if I don't treat it? Well, ulcers don't always get better on their own. Left untreated, they can cause internal bleeding, which you might not notice until you feel faint or see dark, tarry stools. In rare cases, the ulcer can eat a hole in the stomach wall, spilling stomach contents into the abdominal cavity, a condition known as perforation, which requires emergency surgery. But before we get too worried, let's focus on what we can do to prevent ulcers or avoid them returning. The first and most powerful tool is awareness. Listen to your body. Don't ignore pain that comes and goes, especially if it's always in the same spot. If you notice changes in appetite, unexplained weight loss, or dark stools, see a doctor. Second, be cautious with medications. If you take pain relievers often, talk to your doctor about stomach-friendly alternatives. Never take these medications on an empty stomach and avoid combining them with alcohol. Third, consider your lifestyle. Cut back on alcohol and smoking, which are known to increase the risk of ulcers. Eat smaller, more frequent meals rather than large, heavy ones. Choose foods that are gentle on your stomach, lean proteins, cooked vegetables, whole grains, and avoid very spicy, acidic, or fried dishes. And perhaps most importantly, manage stress. Stress doesn't cause ulcers directly, but it can worsen symptoms and slow healing. Lastly, follow up with your healthcare provider. Ulcers are manageable, but they require attention. Make sure you finish any course of antibiotics prescribed to kill H. pylori. Continue your medications as advised, and return for checkups to ensure the ulcer has fully healed. As someone who has likely faced many health challenges over the years, it's easy to brush off stomach discomfort. But ulcers are one area where early action makes all the difference. With knowledge, proper care, and healthy habits, you can protect your stomach. Avoid serious complications and live comfortably for years to come. Thank you so much for watching until the end. I hope today's video brought you some helpful insights and a little peace of mind. If you found it useful, don't forget to like, share it with your loved ones, and subscribe to the channel so you won't miss any upcoming content. And if you'd like to keep exploring, click on the videos showing on the screen. There's so much more waiting for you. Take care, and I'll see you in the next video.